As the county executive said, over the course of the past 3 or 4 years, we have seen a pretty significant decrease in the number of overdose opioid deaths that have occurred here in Erie County. At the same time, we have seen a correlation with an increase in the number of arrests that have been made regarding heroin and fentanyl over the course of the past few years. We have, in my opinion, two added elements that have occurred this year. One is COVID, where we are seeing that crime in general, especially the crimes that can be taken underground, taken, for lack of a better phrase, in-house, has been just that, gone underground, gone in-house. The only major uptick in crime that we've seen over the course of the past 6 months has been in shootings and homicides. You can't take a shooting or a homicide really in ground or underground or in-house. But when you look at domestic violence, when you look at alcoholism and drug use that can be done kind of in-house, underground, that is due to the COVID, in my opinion. And that is a situation that I think that we are seeing now here in Erie County over the course of the past 3 or 4 months. You add in the second element, which is not necessarily new, but it's becoming more prevalent, and that is cocaine. We are seeing a significant increase in the number of overdose deaths that result from a cocaine and fentanyl mixture. And the problem is that the more cocaine is being cut with fentanyl, the more deadly it is, and the more deadly it's becoming. And so I just caution everyone. Obviously, I don't want people using cocaine in general, but I caution those, like the county executive said, who may be older, long-term cocaine abusers, to please stop, to please recognize that there may be fentanyl or heroin that is cut in the cocaine that you think you're buying. And you're not going to know it. You're not going to know it by the smell. You're not going to know it by the texture per se. You would actually have to do a test to determine if, in fact, it is fentanyl or heroin. Unless you are a sophisticated, very sophisticated user, you're not going to be able to look at it and actually feel and tell the difference in the cut. And so I implore those who are out there who may be users who have a problem to come in and get help. Please do not use these products, because obviously we are seeing a significant increase in the number of overdose deaths overall. And it's very unfortunate, especially after years and years of decreasing the number of overdose deaths. So with that, I will turn it over to Dr. Bernstein, who has been obviously just instrumental in not only helping us out during the COVID here, but obviously helping us out over the course of the past 3 or 4 years in reducing the number of overdose deaths.
Thank you, John. So as our county executive and has mentioned, we're seeing a new population of people who are victims of our overdose deaths. These are people like my age, and people in their 40s, 50s, and even 60s. They're professional, and they're found at home alone. And almost half of them, 45% of our opioid-related overdose deaths so far this year, have been with a combination of fentanyl and cocaine. So we think that people are at home, they're alone, struggle with so many losses, and are using cocaine is recreational, something fun, and not realizing about the danger. So we have to understand that every time you buy some product on the street, any white powder can have fentanyl in it. I mean, it's our numbers here. It's like rolling the dice. It's almost 50-50 chance. So with COVID-19, we've all had to change the way we do things. And the Erie County Health Department, we've had to change the way that we respond to people in crisis with suffering from opioid addiction or any type of use, or even if they are connected or not connected with our substance abuse treatment agencies. So first of all, we are help is available. So we want everybody to carry Narcan whenever they can. Again, you never know when you might need it. You could be home with a friend and partying, and all of a sudden somebody falls out. Or you could be home, doing some cocaine, and you not realize that that has fentanyl in it, and start to feel woozy. Again, it's really important to have Narcan with you at any time. So the question is, well, in this COVID-19 crisis, and we're all supposed to stay inside, how do I get it? Well, so there are different ways to get it. First of all, you can text for Narcan. We have a program where you can text 716-225-5473 and say that you want Narcan. We will ask no questions except how we can get it to you. That's the only question we're going to ask. Also, we have right here our emergency Narcan boxes. So if you're affiliated with a business or a school type of organization, we will supply these boxes for free. So please reach out to the Erie County Health Department, and we can supply you with a box with Narcan. And if it gets emptied for some reason, people are using it, that's good. We want them to use it. Let us know, and we can refill it for you. Also, we're doing a lot of outreach events. We're doing these pop-up clinics throughout the summer. Our next one is in the town of Tonawanda on August 8th. And we're also weekly at the St. John Canty Church parking lot in Buffalo every Thursday from 4 to 7 p.m. Also, if you want to get trained right now, today on Narcan, so all my media partners, I strongly encourage you to stick around a little while. Our Narcan trainers par excellence are here, and they will give you a dose of Narcan and train you on how to use it, so you will be empowered to save lives if the opportunity becomes available. Also, if people are seeking help, if they realize that they're struggling with a problem and they want to get help, or they just want to get information, you can call our Erie County Addictions Hotline 24/7 at 716-831-7007, just like James Bond. You can also walk into any emergency department in Erie County and ask for the Buffalo Matters team, and you can access medication-assisted treatment with buprenorphine. And you can actually get a dosing on the spot if you're in withdrawal, and walk away with actually a prescription for a 2-week supply, not just a 1-week supply, but a 2-week supply of low-dose buprenorphine or Suboxone to help you get through until you can get to your appointment. And then also they will make an appointment for you in the emergency department before you leave and link you up with a peer to help you out through those really difficult times, because we're all struggling with really difficult times. You should not be ashamed. Also, we have a great video to train people about how to use Narcan. They're very short. They're just about 8 minutes, and we produce them. And it's how to save a life with Narcan. So it's just 8 minutes, and it's on the Erie County YouTube channel, so you can tune in and learn for yourself how to save a life with Narcan. So again, if you want to learn more about our opioid epidemic during our COVID-19 pandemic, Our next Erie County Opioid Prevention Task Force is on August 3rd, so that's Monday. So you can get a great update on everything you want to know, but we're afraid to ask about what we're doing in our community to fight our opioid epidemic. Because, as we tell you every day, COVID-19 is still here. We still have to wear our masks. Our opioid epidemic is still here. We still have to be armed with our Narcan. So please think about treatment. Think about saving lives, because that hasn't gone away. So I'm going to turn it over to our new Mental Health Commissioner of Health, Mark O'Brien. Thank you.
Thank you, Dr. Burstein. Thank you, DA Flynn, this county executive. Hopefully people will see this as a wake-up call that fentanyl knows no race, creed, color, or age. It's an equal opportunity killer. And what's happening right now is that people, their sense of invincibility is really getting in the way of some really good judgment, and that people are not making good decisions around this. And they're turning to cocaine or turning back to cocaine, where opioids are not available in the same way they were. That's why there was a spike in heroin use. So fentanyl is a complete depressant of the respiratory system that works very quickly. You also have the presence of carfentanil that's being used to cut, which is much stronger and is very, very deadly. So we're really appealing to folks, not only for yourself, but for every life lost, is somebody's out there who actually loves you, and you mean something to somebody. So we're appealing to folks who, if you can't think about this for yourself, use that good judgment for that person who's sitting across the table from you, who's sitting next to you as your son, your daughter, your niece, your nephew, because your death affects not only you, but a whole ripple of folks. So we're very fortunate in this county to have a strong network of providers, prevention specialists, and community supports that are out there. And in the age of COVID, telehealth has been very important. People can really get connected to health from their own living room. You have a computer, you have a smartphone. There is help available both through self-help support and the vast network of prevention and treatment providers. So again, these are strong words that we want people to think before they act, because that decision you may take today could be your last. So I want to thank you all very much. Mr. County Executive.
Thank you, Mr. Commissioner. We know, we've heard from our staff that people say, well, my dealer doesn't sell cocaine that's got fentanyl in it. And guess what? Your dealer doesn't know it's cocaine. And there's probably fentanyl in it. Earlier this year, I talked about this, and it became a joke among people in some circles. They put a face on a shirt and said, oh, Mark Poloncarz says, wash your hands, don't do cocaine. Thought it was funny. Since that was said, people in our county have died from overdoses due to ingesting cocaine, snorting it, taking it another method. And that's just sad, because we know it could be prevented. We have a great team in our community to fight addictions, to fight substance abuse disorders. We have Narcan-backed boxes everywhere. We offer free Narcan to any user, no matter who they are, where they are. As Commissioner O'Brien noted, opiate, substance abuse disorder, it's an equal opportunity killer. It doesn't care about your race, doesn't care about your age, doesn't care about where you live. It doesn't care about the money you have in your bank account. If you take it and it's not in it, there's a very good chance you're going to overdose and die. We want people to understand that this is serious and help is available. If you need help with regards to an addiction, call us at 317-007. Our 24-hour hotline is available for your help, and you will talk to a professional immediately who can help you start down your road to recovery during that phone call. We are here to help you, and we want to advise those who use cocaine, who think it's just a party drug, it's just a fun drug. Well, you know what? That party drug, that fun drug, it's not a party drug, it's a fun drug, it's a death sentence right now. It's a death sentence because what's in it? Fentanyl. Carfentanil. Carfentanil is used to actually tranquilize elephants. I remember when we were dealing with it when on the opiate task force and the impact it was having in the Ohio Valley and how they were like, please, you hope it never comes here. Well, it's actually being cut and put in cocaine. So if you want to have fun at your next party, don't use cocaine because you may not survive the party. With that, I'd be glad to open up to any questions for all of us, and then we'll go off topic. Mr. McKinley. District Attorney, sure.
I suspect that it does. I don't have enough empirical evidence right now to make that, 100%, definitive yes to your answer. I suspect, though, listen here, I know this. I know that more individuals are out of pretrial custody now than they were pre the bail reform. Are all of those individuals now potential people who are going to be buying drugs? Dave, that I don't definitively know. But obviously, if you have more people who are involved in the criminal justice system who may have been in custody beforehand and are now out of custody, that potential is there. Specifically, though, with regard to the opioid court and the drug courts that we have here in Erie County, I think that the fact that individuals can no longer be kept in custody, probably more like it, who are going through opioid court may have a significant impact. I do.
Are there any other questions, Sandra?
We're finding a wide spectrum. So there could be professional people, people out of work, people are uninsured, people of Medicaid. I mean, we're seeing a spectrum. However, we know that we hear from our colleagues that there are a lot of people who are who used to be out in the office. And, now they're at home alone and struggling, and there are a lot of temptations. It's not just cocaine. It's not just heroin. I mean, people are struggling with alcohol use disorder, and it's really difficult for them to be home alone and not with other people and in support. So, we're seeing through the spectrum, unfortunately. Thanks.
Well, there's many treatment facilities, and I'd probably turn it over to Commissioner O'Brien to talk a little bit more about all the treatment facilities. I think every organization understands it's a slightly different environment now because of the revenue cuts that the state and the county have seen, to the point where the state has already started to cut funding on grants and other programs by 20%. It is a concern. It's something we're going to deal with, and that's why we have to advocate for federal support for state and local governments in the next round of stimulus funding. Actually, I was on a call earlier today with the National Association of Counties, of which I'm very proud to announce I was elected to be the Northeast region's representative on the executive committee. So I'm one of 8 people who now will be making policy for a national level for the county's organizations. And it was the number one priority we talked about was ensuring that federal funding continues with what would be like CARES Act Round 2. The House has the HEROES Act, which is a $3 trillion program. The Senate has announced the HEALS Act, which is a $1 trillion program. The Senate Act does not continue any funding for local governments or state governments. That cannot happen. We need to get assistance from the federal government for the loss of revenue that we've received as a result of the COVID-19 outbreak. And if we don't, we're going to have significant program cuts. Everyone understands that. And everything is on the table. Would we eliminate program funding? No, we would, of course, not eliminate program funding for programs that deal with addiction. But everything's on the table when you're talking about billions of dollars in revenue shortfall in New York State, or as what we were projecting for 2021, after we've already reduced our budget by over $100 million for this year, is a potential another $100 million deficit. So what we need is federal assistance. If we get the federal assistance, whatever form it might be, but directly coming to local governments, then we will be in a position where we're not going to have to worry about cuts. I'll turn it over to Commissioner O'Brien to talk a little bit, but there's so many organizations out there helping that in some ways I don't think people understand all of the groups that are out there. Save the Michaels is just one, but you've got so many others, Horizons, Evergreen, that deal with this every day, and he can talk a little bit more about what we're doing and how funding has not been cut for those programs.
The county executive is spot on. There's a couple of things. The county is really blessed in terms of a very robust network that has a treatment continuum, everything from self-help support to 820 residential facilities to outpatient to all in between. And there's multiple agencies, as he mentioned, Endeavor, Best Self, Spectrum, Human Services, Horizons. They're all out there. Save the Michaels has come along as really kind of vehicle to connect folks to those various ones, as more opposed to it being a treatment facility itself, although they've opened one up in Niagara County. The big problem right now is, as the county executive said, is what those cuts or withholds happen. So right now, the Office of Mental Health has had to do a 20% withhold just on 4 substance abuse services, has had to do a 31% withhold. Now, they're not calling it a cut because it's not a cut yet, because they're still hopeful that those funds can be restored. But yet, that's 31% that's not going out of state aid that passes through the counties, that goes out, and there's a county share with that goes out to these organizations. And at the time that these organizations and the population can least afford a cut, a withhold from the state is still a temporary cut to these not-for-profits who operate on a thin margin anyhow. So really the time for advocacy is right now, where that need for federal assistance to the state and local governments, because it's coming down through the Office of Mental Health and the Office of Addiction and Substance Abuse Services, that's state OASAS, and that impact is out there and it's real. So again, the resources are there right now. It's a good, robust system, but they've already been suffering. They've already adapted to the COVID crisis and very creatively. But we really do not want to see any services suffer right now. And now is the time really for folks to really talk to their county, their state representatives, and particularly their congressional representatives at the federal level. That's where the advocacy needs to happen.
Thank you, Mark. Any other questions on topic? If not, I'll take an off topic. With regards to the Florida Marlins testing positive, of course I'm concerned. We have received additional guidance from New York State, as well as we've provided additional comments and questions to Major League Baseball. We were waiting to hear back from those from the Major League Baseball, from the Toronto Blue Jays. I think they're worried. They have no interest in having their players and team exposed to a team that has an outbreak. There's no doubt about it. I mean, you can't sit there and say it's not an outbreak. My understanding is Major League protocols were 4 or more was an outbreak, and now we're talking in the teens. So I am concerned. There is some time before they come. They had their game canceled last night. I know Major League Baseball is very concerned. They do not want to lose their season. We are waiting to hear back from Major League Baseball in response to the questions and comments that we provided to them on how they're going to ensure the safety. We do know that New York State's guidance is they must be quarantined because they're coming from a state with an outbreak and they have an outbreak themselves. I don't even know how they're going to field the team at this point, but they would have to be quarantined, one per person in a hotel room, could not leave the hotel until such time as they're taken to the game. They would play the game. To tell you the truth, the Blue Jays are worried about playing a game against a team that has an illness, just like every team is worried about playing a game against a team that has an illness. Ask the Philadelphia Phillies, who I think are pretty upset right now that their team was exposed to members of the Marlins at the time that they knew that they had an outbreak on their team. So, yes, I'm very concerned, and we still have some time to address it. I don't even know if the Marlins are going to be playing because of how everything is. We'll just wait and see.
Well, we will hope that we will be invited to be involved to assist with the operations of the quarantine. I mean, hopefully they have policies. I mean, again, it would just be like anybody else who is in quarantine. They'd have to stay in their room. Food would have to be delivered outside their door. They wouldn't be able to have people make up their room. They could just have like towels left at their door. And then with other team members be escorted to the game. So we can operationalize it, but we'll need cooperation from the teams and the baseball league and hopefully work together, and they'll have good policies and procedures to get this done. We haven't been involved in those discussions.
We are having direct conversations right now. As I said, we've submitted a series of questions and concerns to Major League Baseball in response directly to the Marlin issue. We had general concerns that we were alleviated beforehand, but this is directly to the Marlins issue. And those were provided to the Bisons. We're expecting to hear back, if not later today, tomorrow, from the Blue Jays directly and Major League Baseball in response to our concerns and comments. And with regards to quarantining, we know you can successfully quarantine in a hotel. We know that because we do it. We have a hotel that is dedicated solely for quarantine purposes to put people who have COVID-19 that cannot otherwise quarantine safely. And it can be done, and you can do it and protect the public. David. You mean the line controller? I'll get into that. You lied. Yes, a union employee. Well, let me answer this, David. Let me answer this. He's a really bitter man after finishing third in a 3-person primary when he was rejected by his own political party. He wanted to run for county executive and decided not to do that because he thought he was going to be a congressman, and then the people of his own party rejected him. And then he issues 2 reports which have flaws in it I haven't even seen the second report because he released it to the press before he released it to the public, which I guess is the press, the public, but that's how it goes. I understand it. But he lied. Michael Zuccalla is a union employee. Michael Zuccalla has a salary, which is salary. He just doesn't get paid that. If he doesn't work the hours, he doesn't get paid it. The only salaried employees, I should say, in Erie County are the elected officials. We get paid the same amount regardless of how many hours we work, whether we work 700 hours a week or 7. Mr. Zuccalla offered to assist in any way possible rather than sit home and do nothing like a lot of the staff was. He became a contact tracer. He helped man the call center. He did it on Good Friday, Easter, because we couldn't get people to man the call center on Good Friday and Easter. And he got overtime because we pay our union employees overtime when they work on a holiday. We have union employees that make more than that, David. We have union employees that make $100,000 a year plus. He's pointing on Michael Zuccalla. You want to know why? Because Michael Zuccalla is in the town of Amherst. That's why Stefan Mihailu is picking on him. Stefan Mihailu is a bitter man. The people of his own political party rejected him. They said, you know what? There's 3 candidates. You're going to finish third. He's an angry man. For the last 2 years, he drove around the 27th Congressional District. He spent more time in Livingston County, Orleans County, Niagara County, Wyoming County, and Ontario County, and in Monroe County, then Erie County. And guess who paid his salary? The people of Erie County. So, paid a salary whether he works 1 hour a week or 100 hours a week. But the other individuals who received overtime, they get it because it's based on a contract. Mr. Zuccalla, like a lot of the other people that are standing behind you, and I'm going to ask you, are you going to criticize those individuals from the health department who worked countless hours during the COVID-19 crisis and got overtime for it? Are you going to criticize those individuals who at the same time were working to protect the lives of individuals who suffer from opiate abuse, who have overdoses, and then are also working to protect the public from COVID-19? That's exactly what those people standing behind you did. And I'm not saying you're criticizing it, but the comptroller's criticizing it. But you're asking a question based on the faulty premise. He had a faulty premise and he lied to the public, he lied to the press. Mr. Zuccalla is a union employee. Mr. Zuccalla earned the time that he worked. He worked on behalf of this community. He learned to become a contact tracer. When we asked all of our county employees, we need you to become contact tracers, and people across the entire spectrum learned how to become a contact tracer from the Department of Public Works, from the Department of Health, from the Department of Emergency Services, from the Medicaid Inspector General's office, from the Department of Social Services, from the Department of Mental Health. They all learned how to be so that we could get into phase 1, 2, 3, and 4. While Mr. Mihailu campaigned in other counties on the people's dime, these people were working to protect the public and save lives. Shame on Stefan. Shame on Stefan. Thank you all.